بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. معكم المدرس الدكتور باسم بياتي، فرع الأحياء المجهرية، كلية الطب، جامعة بغداد. محاضرتنا اليوم هي Nocardia species. The objectives of this lecture: introduction and the general characteristics. Nocardia species are named after the veterinarian Edmond Nocard. They are gram-positive, branching, beaded, aerobic, non-motile filamentous bacteria that are stained with acid-fast in tissues found in environment not part of a human normal flora, often opportunistic, which means that they cause infection when predisposing factors occur. Can cause sulfur granules like actinomycosis. Virulence factors, toxins, enzymes, toxicity to macrophages, inhibit phagosome-lysosome fusion, giving rise to L forms which can survive in macrophages for days. The mode of human transmission in the case of nocardiosis are: first, minor trauma; second, direct inoculation of skin or soft tissues; third, which is most common, is inhalation. As we mentioned before, Nocardia species are opportunistic bacteria, which means that they cause infection when predisposing factors occur, such as pre-existing immune dysfunction, steroid use, organ transplantation, alcoholism, hemolytic malignancy, HIV, chronic pulmonary disorders, and TB. Clinical presentations represented by: first, mucocutaneous, which are commonly misdiagnosed and often occur in normal hosts after minor trauma, animal or insect bites, located distally on the limbs. Presentations: supraputive granulomata, progressive fibrosis, necrosis, sinus formation, and destruction of adjacent structures. Here cutaneous، نشوف بالصورة cutaneous nocardiosis with cranial and cerebral extension. الصورة الثانية A, cutaneous nocardiosis with ulcerated lesions. بالصورة B, same patient with healed up and scarring lesions. إذن هي مشابهة للأكتينومايكوسيس، تترك scarring، وأيضا قلنا بالجنرال characteristic to produce sulfur granules like actinomycosis, like actinomyces. The second clinical presentation is pulmonary, which is the most commonly reported presentation. Halo sign can occur, and the progressive fibrotic disease may develop following inadequate treatment. Other presentations include CNS and eyes. The diagnosis: Nocardia species are difficult to recognize and identify in routine labs. Specimens, which are differ according to type and site of infection, as we mentioned before, involve sputum, pus, biopsy, autopsy. Stained smears show gram-positive beaded branching filaments مثل ما نشوف هنا بالصورة الأولى. Modified Zell-Nielsen staining showed branching acid-fast bacilli. Biochemical test: catalase positive, reduced nitrate, and utilize urea. PCR is the most reliable diagnostic test. هاي pictures نشوف بيها بالصورة A هي histology of nocardiosis with inflammatory cells around it. بالB نشوف irregular staining granular structure surrounded by RBCs and necrotic tissue with a few neutrophils disease. Here on the culture, Nocardia species are aerobic and slow growing, which can grow on most bacteriological media. Typical colonies are buff or pigmented, usually seen from 3 to 5 days. Selective media here: blood agar, Thyromartin agar with antibiotics, brain heart infusion agar, trypticase soy agar enriched with blood, saccharose agar, paraffin agar, and Lowenstein-Jensen media. نشوف بالصورة اللي بيها تيوب هي yellow pigmented colonies on Lowenstein-Jensen media. ونشوف هاي chalky white dry colonies on blood agar. Early treatment: usually non-CNS cases usually treated up to 6 months, whereas CNS cases usually treated for 1 year. Relapses may occur after stopping treatment. AIDS patients and perhaps other immunocompromised, immunocompromised patients should be maintained on lifelong suppressive therapy. Thank you. Goodbye.